Good morning, good afternoon, good evening, ladies and gentlemen, from wherever you're watching us from. This is yet another episode of Ask Your Gyna series. And as always, we have a very interesting topic to dive into. But before we get into that, I'd like to introduce our amazing guests in studio. Yes, Katulisana, introduce yourself.
My name is Dr. Miteche Pogen. I'm an obstetrician gynecologist, and I love to teach and advocate for patients' health.
Oh,
And I'm Dr. Karanja Mwangi, also an obstetrician with gynecologist. Thanks for having me here, Leno, to discuss today's topic.
we're excited to have you on board, and today's topic is even more exciting. We're going to be demystifying a lot of myths that people may have concerning this particular topic. And today's topic is vaginal delivery, or what people call normal delivery, versus CS. And just to start us off, what exactly is vaginal delivery?
So, vaginal delivery basically means the baby is born through the vaginal canal. People like to call it normal because it follows the natural physiological process of giving birth.
Yeah.
However, cesarean section is still not abnormal. It's just another different way of giving birth and sometimes life-saving. But at the end of the day, it's the safety of the mother and the baby that we are looking at.
Oh, nice. Because, most people assume the normal way of doing things is the vaginal delivery.
Yes.
But when it comes to CS, it's a whole different thing, because there's that assumption that it's only done when there's an emergency, when there's breach, and all these words that are used. So having given that explanation, it helps to know that it is both. They're both equally important. And
Yes.
normal. Yeah. So what is CS delivery?
CS, let me put it in front. Cesarean
Cesarean-section. Okay.
Most people just know CS.
Yes.
CS now is like the opposite of the natural birth, vaginal delivery. So this is when a mother is operated. It's actually an operation, surgery, to deliver the baby. And it's usually through the abdomen. So we usually make an incision in the abdomen to deliver the baby. And the main issue in cesarean section, it could either be planned or emergency. Yes.
Okay.
But you actually go to theater, the mother is numbed, or she's given the general anesthesia, but you're delivering the baby not through the birth canal.
Okay.
It's through an operation. Yes, and there are many indications which we will discuss. And just to go in detail, the operation usually takes around 30 minutes to an hour most of the time. Sometimes it can be more than an hour, depending on the different cases and circumstances.
All right.
But we'll go into the details of the sense. Yes.
And there's an observation that it has become very common. Why is that?
Yes, cesarean section is very common, right? Just to quote the World Health Organization, although it's debatable, they advise cesarean section should be 15% of all the normal deliveries. Meaning if you have 100 deliveries,
Okay.
the rate of cesarean section should not be more than 15.
Okay.
So you have 100 women, 15 should be cesarean section,
And the rest
85
should be. Oh.
Now back to your question. Currently, women are more enlightened. So even during clinics, as much as everyone would prefer everyone to go the natural way, so you usually enlighten the women what are the options.
Okay.
That is what we advise currently. So cesarean section has increased because of the sensitization, and women are enlightened. They understand what is normal. They understand what is cesarean section. Then they make that choice. So there are women who choose to go the cesarean way. The other bit is more of historical, because we've realized with normal delivery, it also comes with the complications.
Oh,
Now we can predict if a woman
yes,
is going to get a complication.
yes,
And the most important thing about delivery is you want a normal baby
yeah,
and a normal healthy
mother.
mother. So currently we emphasize more on the health of the mother and the baby.
Both.
So if
Yes.
at any one time the
Mm.
mother is at risk or the baby is at risk, then you need to abandon the vaginal delivery and go the cesarean section again. That is why they read as a no. And more on the enlightenment is that if a baby and a mother complicates, we've seen many litigation cases very valuable. So even as medical practitioners, we become more cautious.
Yeah.
So that you don't want to buy time for the unpredictable.
Yes.
And if a complication happens, you ask yourself, why didn't I?
Yes.
That's why the cesarean section has hammer increased.
Oh, okay. Because there's this assumption that any woman who opts to do CS is either avoiding the pain of labor and normal delivery. That's the assumption in the community. But listening to what you have said, it makes more sense, because there are people who actually feel guilty for choosing the CS,
Yes.
as opposed to having a normal delivery when they actually can have a normal delivery.
And the opposite is also true.
Mm-hmm.
We've met women who deliver normal
Yeah.
and they're going for a CS,
Mm.
and they will tell you they will go for a CS a second or a third time.
Yeah.
And you still find another one who has done both, and they'll say, I will prefer normal than a
Yes.
CS. So there's so many factors you look into,
Okay.
both medically and also the mother. The mother's factor is very important. So you don't just say medically, this is what we want. You give her the choices.
All right.
Then she makes that decision.
Okay.
I think just picking up from what Dr. Karanja is saying is we don't make the decision to do a CS casually.
Okay.
It's actually something that is timely. We discuss with our clients and make it very open for them to understand the risks, the complications, and the advantages of delivering both ways, vaginal or versus a cesarean section. Maybe in the next discussion, we'll be talking about why women are starting to think what he said, enlightenment.
Yeah.
They want to think CS is better than a vaginal delivery. The assumption out there is if you deliver via CS, then your vagina does not change. That's not true. The vagina starts changing immediately you conceive in preparation for the birth.
Yeah.
And it's a muscle. So it recovers as soon as it's supposed to recover. So delivering via a CS and a vaginal delivery, I would want it to be very clear. It does not affect how the vagina will be after delivery.
Wow, interesting. Yes. And what are some of the advantages or pros of vaginal delivery?
I think first and foremost, all women get pregnant to have a baby. So I would say first thing, there'll be very early bonding between the mother and the baby because the baby is going to be able to be put on the breast, or what we call latching, almost immediately. There's less recovery time, which means shorter hospital stay, and then less complications of infections and bleeding. And then, of course, we avoid future complications in pregnancies in the future. So, for example, if you deliver via CS, sometimes we have the placenta attaching itself on the scar where we removed the previous baby.
Yeah.
Yes. Dr. Karanja, would you like to add any other benefits of vaginal delivery?
Yes. Vaginal delivery, there are those women and some communities who prefer having even 10 babies, 12 babies. I've seen you're surprised.
Yeah.
It happens.
Yeah.
So the advantage of vaginal delivery, we can allow you as many as
Oh,
Yes. But with cesarean section, it will reach a point. The more cesarean sections you have, just like any other surgery, the more surgeries you have, the more the complications. So by the time you reach your third and your fourth cesarean section, most of the time we'll advise you not to have because the complications worsens with each pregnancy.
Yeah.
And not only during delivery, even during the pregnancy. We call them high risk mothers when you operated many times. So vaginal delivery has that advantage.
What?
Now, for cesarean section, the bleeding is usually more.
Yeah.
And the risk of severe bleeding
It's
is
been
more
hard.
than normal vaginal bleeding.
Yeah.
Although even in theater we have measures we take. I
Yes.
think Dr. Day will discuss that on how we can prevent the bleeding. But compared to normal delivery, cesarean section, the bleeding is low. Of course, infection or operations. Once you open a wound,
Yeah.
skin,
Yeah.
the risk of infection is high. So with a normal, okay, let me not say normal, the vaginal delivery,
Yeah.
if there's no tear, there's no episiotomy, the risk of infection reduces.
Wow. Okay.
Because there's no breach of the skin or the vaginal mucus. And of course, the cost. She mentioned there's a longer hospital stay
Yes.
for CS, cesarean
Yes.
section.
Yes.
So for normal delivery, you deliver today, you go home tomorrow. Some hospitals actually, if you deliver in the morning, they really
home.
hold it. So the cost is less. Lastly, and this one is more technical. Usually during labor, when you're having the contraction, it squeezes out the fluid that is in the baby's stomach. When the baby is inside, there's a lot of fluid in the lungs.
Okay.
So when the baby is delivered, you need that fluid to come out. So during labor, it helps squeeze out fluid. So you'll find sometimes people who are born by cesarean section, they are at more risk of developing respiratory as opposed to vaginal.
Yes.
Yes, those are the advantages of vaginal.
All right. And some women fear pain, labor, tears. What's your advice or take on that?
I would say lots of women fear. All women.
Yes.
We fear.
Yeah.
Yeah.
Celebrates when they are having pain. Actually different. We have different pain thresholds.
Yeah.
And the fear of pain, you can still deliver normal. Because what we usually do advise women is, yes, you tell them labor will be painful.
Yeah.
But there are measures we can do, either to reduce or to stop the pain. I'm sure you've heard about the Pichuro, which we don't commonly do it for most of the hospitals. And there are some painkillers we can give. It might not knock off all the pain,
But it reduces.
Yes. And there are techniques that you can use, breathing techniques. Is what we call Lamaze classes. There's some exercises you can do during labor that might divert your mind from
The pain.
Yes.
Okay.
Now, pain is pain. If someone has said they don't want pain,
Yeah.
it's pain.
Yeah.
Yes. So if they tell you, and most women actually, those who request for cesarean section, because it's always good to the doctor to know why do you prefer CS or not a vaginal delivery. They will tell you labor pain and tears.
Okay.
Either vaginal tears. And there are also ways of we do it during a normal delivery to avoid getting a tear. Although sometimes it's
inevitable.
There's a way you manage that. So it's true. Women fear pain and they fear tears.
All of us fear pain.
Including men. You've seen men who cry during labor.
Some
So-
actually pass out completely.
Yes.
So, yeah.
So it's not only women who feel.
Yes.
Everyone else.
It's a very scary picture.
Yes.
Very scary.
And even before, it's not that these days women fear death. It's only that they speak out more. The current generation.
Yes.
You know, our forefathers, a woman was,
You
let me say,
actually,
suppressed.
yes.
They will not speak out of their feelings. But right now we are free.
Yes.
Trust.
Yeah. We are more expressive as women.
Yes.
Yeah.
And
Which is a
choices
good
are
thing.
there.
Yeah. So, what are some of the reasons why you'd opt for a CS for a mother?
So, first of all, I would like to just say sometimes we do cesarean sections as emergencies and sometimes we call them electives. So, elective means we have planned for the cesarean section. Now, when it comes to also emergencies and electives, maybe so that I break it down and make it easy for the people watching, then I'll talk about the maternal reasons, which is reasons that are concerning the mother and the reasons that concern the baby. So, for example, if we are having what people call in Swahili, njia haifunguki vizuri, it's obstructed labor. So it means either the outlet where the baby is supposed to be passing is either not enough for the baby. That's one of the reasons. The other reason is the mother is actively bleeding and we are doing it as a life-saving measure towards the mother or the baby. Okay, so it's what we call placenta previa or placenta abruption. Now, and then some other times now it's causes related to the baby. So the baby is in distress. The baby is, tunasemanga kuchoka. Mtoto amechoka either with the heartbeats that we are listening to by the machine or we are seeing some discoloration of the fluid that normally comes. We call it meconium. So if it shows a distress picture for the baby, then we go in to save the baby. If the baby has the cord around the neck, amejifunga na kamba ama na, people call it placenta, but really it's not the placenta. It's the cord that supplies food from the placenta to the baby. So kama amejifunga, then we cannot allow that baby to deliver normal. The other reason is mtoto amelala vibaya. So baby malposition or malpresentation. So the baby is either not having their head down, because we like to do vaginal delivery when the head is down.
Okay.
So either they're presenting with their legs, they're presenting with their bums, or they're lying across, or even it's the head, but the head is like it's presenting the face or the brow. So we want the baby, there's a way we want the baby to present flexed like this, so the chin touching the neck, so that the space of the head is enough for the outlet. So those are some of the reasons. Have I left out any, Dr. Karaj?
Actually existed.
Okay.
All right.
Yes.
It's all the choice.
Yes.
Mother chooses.
To deliver virus, yes.
There's some who actually go into labor. Labor is very normal. But along the way, maybe they didn't predict that pain would be
that extreme.
Yes, because pain is very subjective. So someone can choose vaginal delivery. Then along the way, they change their mind. They tell you they want to go for CS. Of course, you still have the same conversation. CS, these are the risks, these are the benefits. If you still want to continue vaginal delivery, we allow you. If it's about pain, this is how we manage it. But if she says she wants to go for CS, you're allowed to go for CS. So long as she's informed. CS versus.
Yes. And what are some of the advantages of CS delivery then?
The advantage of CS, from the medical point of view, and there's also the mother's point of view. As Dr. Matei has mentioned, there are many reasons why we do CS. So to avoid complications for the mother or the baby. But to go straight to your point, we call them elective CS.
Okay.
Meaning you have planned to do it. So along the pregnancy journey, pick a date to say we are going to do this CS or this date. So it's predictable. Everyone can plan.
Yes.
You can even call your relative say, I want you here at this time. You can buy everything that you need. Predictability is good. With vaginal delivery, though natural, it can come anytime. During the day, at night, anytime. So it's a victim. So for CS, you can plan.
It is scheduled.
Yes, it is scheduled.
Yes.
If you are at some of 6 a.m., say 6 a.m., you want the baby hand. Yes. But of course, the baby has to be mature. You don't deliver 34 years just because you prefer a certain date.
I'm umechoka.
You're done. You want it out.
Yes.
Now, we've mentioned some of the complications of vaginal delivery. There's a lot of birth trauma that happens. Those are the complications like tears. And sometimes we also do an episiotomy. That is, we do a cut on the birth canal just to increase the chances of a normal delivery and reduce the tears.
Okay.
So if you compare normal and cesarean, for cesarean sections, there's less birth trauma. Yes, birth canal trauma if you compare it. Yes, these are the main advantages of a cesarean section.
So do you advise someone to opt for CS as opposed to normal or rather vaginal delivery?
Maybe to add, another advantage, of course, is pain before the baby is delivered. For vaginal delivery, you have pain until the time you deliver that baby, but unless you go for epidural. For cesarean section, before the baby is delivered, there's no pain because during the operation, there's that anesthesia that you're given, so there's no pain. The pain comes later, after the operation, when now you recover. Now, in terms of advising professionally, if there's an indication, if the baby is at risk or the mother is at risk, I would advise you to go for a CS. If there's no risk, I will let the mother choose.
Okay.
My duty as an obstetrician in all of this is to tell the mother how vaginal delivery is, the advantages and the risks.
Okay.
CS are the advantages and the risks. Then the mother chooses. But of course, in our setup, it's like we all assume all mothers will go
into
vaginal delivery.
Yes.
So we usually wait until the mother now prides us. So someone will say, I want a CS. So now we start that conversation. But most of the time, if they don't say they want a CS, you assume they are going
for the normal delivery.
So I will not advise someone to go for CS if it's not an option.
I think just to pick up from Dr. Karanja, what he's basically saying is the recommendation is individualized.
Okay.
So it's based on medical facts, of course, and the information that you've given the patient. It's not because of fear or trends or convenience. Our goal, remember, is the safest delivery for both the mother and the baby. If vaginal delivery is safe, then we shall go vaginal. If CS is safe, then we shall go for the CS. Remember in the beginning, I said we don't recommend CSs casually, which is what Karanja is trying to say. He would not tell a mother, go for a cesarean section. Vaginal delivery would be the way unless otherwise we have an indication. Yes.
And what are the risks of CS? Complications?
So the risks of cesarean section, it's like any other surgery, okay? So first of all, we are probably going to be running into a greater blood loss than a vaginal delivery. You have cut through the skin, so you've increased the rates of getting what? An infection, because you've cut through the barrier that is supposed to protect you from getting bacteria inside. It also means you're going to stay in the hospital longer. Remember when we talked about vaginal delivery, we said the mother can go home as soon as 24 hours and even in some cases 6 hours. But for cesarean sections, you'll have to stay longer. If you have a cesarean section, most probably your future pregnancy, like Dr. Karanja said, we call them high-risk mothers. They are called high risk for a reason. You've put yourself, or the cesarean section puts you at risk for other complications, including what we mentioned earlier, the placenta staying on the scar. Okay. Or if you go into labor, then you've increased your chances of getting a uterine rupture. And it can even happen before you go into labor.
Yeah.
That is why we like when mothers have a previous cesarean section done, then the subsequent pregnancy, they should be seen by a gynecologist right from conception so that we plan. Are we still going to go for an elective cesarean section so that we avoid the risk of you having a uterine rupture and plan for ACS, or if we are going to try labor? Yes.
And are these risks predictable for every woman?
I would say yes and no. Yes, if first of all you have good antenatal care. I think in this side of Africa, let me put it like that, we tend to go to clinics when our, should I say, tummies start showing. Yes. But really you're supposed to start antenatal care as soon as you find out you're pregnant. Now, if you're having a cesarean section, it helps you plan for two things. First, remember we said you're going to have greater blood loss. So we want your HB to be higher. So that if you lose blood, we won't run into situations where we have to get you extra blood for transfusion. So good antenatal care is one of them. Skilled personnel attending to you. So meaning seeing an obstetrician so that you're able to tell complications early, mitigate early so that you don't run into them and find yourself now running into complications. The other thing is timely intervention. So if I'm laboring at home, this is my 10th baby, and because I want to call myself experienced, sawa, nakaa nyumbani, ninataka uchungu ichache.
When pro,
yes. That runs, especially for mothers who've given birth a lot, we tend to run into that complication because of that thing of, I have done this before. I know what time I should go to the hospital because I'm about to deliver. But remember, if you've delivered many times, you're also in a risk of getting even bleeding after delivery because the uterus does not contract as fast, which means it does not go into a hard or smaller position, which means a wider surface area for you to even bleed a lot. So I would say mothers should go for antenatal care very early. They should choose their hospitals and doctors very early. If they've had complications in the previous pregnancy, they should bring it up in the clinic, whether it's routine clinic or antenatal clinic, and we'll be able to avert these complications.
Wow, okay. Thank you so much for that. And this is for you, Dr. Karanja.
Yes.
We talked about CS.
Yes.
Why is it so expensive? And yet, when you look at the hours compared to vaginal delivery, the hours are shorter. So why is CS that expensive?
No, that's a hot topic.
And it's good you're asking, Karanja.
It's a cesarean section. Yes, it's shorter, but it requires expertise. Not everyone does.
Yeah,
true. But I don't mean that normal delivery, vaginal delivery does not need the experts. Because cesarean sections are done by doctors. And you see it's surgery. You're going to see it.
Yes.
It's involving the surgeon who's doing the operation. There's the anesthetist who's giving you the drugs to run. Sometimes you have to call in the pediatrician who is receiving
the baby.
Yes. Then there's the theater team. And of course, there's the maternity team.
Yes.
Where you are admitted.
Yes.
So there's a lot that happens behind the scenes of cesareans. That's why it's a bit expensive. And of course, longer hospital stay. Usually by the 5 days, that's where we discharge them up. So they stay longer in the hospital. And the drugs they use is also more compared to someone who's done a normal.
Okay.
Now, there's an interesting conversation that usually happens with the gynecologists and doctors and obstetricians that we should actually charge more
for vaginal delivery
than cesarean.
Why?
I knew that's
Yeah, why?
Now, normal delivery, how long does it take?
It takes long. It depends
long.
on the hours of labor and all that.
So imagine if your labor lasts for 18 hours.
Yeah.
So me as your obstetrician, there's all of this. Then there's the midwife, all teams. We have to do all.
Yes.
Yeah.
I can't go
Far.
because anything can happen during labor. So vaginal delivery, though natural, can be more involving than a CS. You might not come many times, but in your mind, you know, there's a lady, there's a mother who is in labor. I have to be on alert. So those 24 hours are quite intense.
Yeah.
As opposed to serious section.
Sure.
Yes, it's 1 hour operation. But after the operation, mother is stable.
Yeah.
You know. So in future, maybe vaginal delivery will be more expensive.
Yes.
Or not.
Yeah.
And there's been a lot of increase in litigation issues concerning complications happening after delivery. What might be the cause of that?
Medical legal. Now, when a mother gets pregnant, the whole community knows
Yes.
this mother is pregnant. Then when she goes into labor, she even makes calls and
Yes,
tells everyone, I'm going to the hospital for the operation. Or I'm going to, she walks herself into the hospital.
Yeah.
Then later, you hear there's a complication, which comes about either during labor or in theater. So as humans, we'll definitely, the first assumption will be there's something that was
Done wrong.
Yeah, in the hospital.
Because the woman was not sick.
Yes.
She came to the hospital walking. So if you don't communicate well as doctors, and sometimes that is also another problem that is making the litigation increase. We don't communicate. We need to communicate better. If there is a complication, you explain the complication and why it happened. And you also predict it. So during antenatal visits, when the woman is coming for the clinic, you're actually supposed to discuss what labor is, normal labor, and abnormal labor.
Okay.
So that the woman can also anticipate. The other thing why litigation is authorized, also people are enlightened.
Yeah.
People are enlightened. Why did this happen? Maybe if I go to court, it will make it will improve the standards for the next woman to have the same problem. And in a way, it has helped because now hospital standards have improved. Yes. So that if I go to a certain hospital, they have a standard of how they manage a certain condition. So not everyone manages their own way. Because once you go to court, you'll be asked, why did you do? You want to do. So now it has helped us as health workers to be more cautious and to move on.
Care.
Oh, okay.
I don't know if you will tell you have an addition on the.
I think it has also made us very good with documentation, which is something we were lacking before. So if you look at it in a positive way, yes, the medical legal issues have streamlined health to become even more, call it strict, so that we are able to do right things at the right time, document everything, and most importantly, communicate with our patients. I think way back, we used to just come and tell you the baby is out and all that. But now every step of the way, we try and communicate as soon as possible because it keeps the relative on the outside, for example, if it's an operation, to know what's going on and even know there might be a complication. The doctors or the nurses or the midwife is doing all they can to avert the complication. And if it happens, something is being done about it. Yes.
So, wow, that was an incredible conversation that we just had. And as a parting shot, so what would you like to tell our listeners regarding the topic of today?
So I would like to say safest delivery is not CS versus vaginal birth. It's basically the right decision being made at the right time for the right woman. That's my parting shot.
Amazing. Doctor.
She said everything. We to add information.
Yes.
Just because someone has chosen CS as a cesarean section, we don't just give it without informing them what it involves and the risks and the alternatives. You have women into CS, and after you have a conversation with them,
we change their mind.
Some choose vaginal delivery along the way. They change their mind. Yes. Your labor is your labor. There are so many stories outside there.
Yeah.
Some are myths, some are. So women come to the hospital scared about vaginal delivery. So discuss with your medical caregiver about the process, the risks, and what is expected.
Amazing.
So as the mother is safe, the baby is safe. Healthy mother, a healthy baby.
Wow.
And maybe just to challenge all pregnant women out there, please ask all the questions that you have to that healthcare provider that you're seeing during antenatal clinic. It's better to leave that office with all your mind is clear of all the myths or the stories you've had out there than go home scared or worse than you walked into the clinic.
Yeah, true. Wow, thank you so much, Dr. Mitei, Dr. Aranja. We are very honored that you came. Oh, Daktari, after all the information you've shared with us, we'd love to know where we can find you.
So I'm usually at Modern Gynae Clinic.
Yeah.
Here in Mombasa, Jubilee Building, first floor, office 1-8.
Nice.
You can walk in at any time, or you can book an appointment. Share our social media handles. Yes, we are on TikTok, we are on Facebook, also we are on YouTube.
Yes. And Dr. Mitei, your social media handles, everything.
My social media handles from LinkedIn to Instagram to TikTok to Twitter is the same. Just my name at Mitei Chepo again. Location is of course Mombasa. I am very responsive. So if you send a message on any of my socials, I'll be able to tell you where to find me.
Amazing. Thank you so much, Daktari. This was it for today. I hope you had a lot to learn from everything that has been explained deeply by the doctors. And it's been nice hosting this show. And we look forward to the next episode. Otherwise, Mungu awabariki sana and we'll see you.
See you next time.